Assalamu alaikum everybody. I'm Dr. Sana Khan from Jammu and Kashmir, India, and I will be talking about a case report. Reversal of diabetic nephropathy with intensive lifestyle intervention. It is about a patient who is 45-year-old male diagnosed with type 2 diabetes mellitus from the last 10 years, and he was presented with us with HbA1c of 10.5%, estimated GFR of 45 ml per minute per 1.73 meter square, proteinuria 2.5 grams per day, and blood pressure of 150 by 90 mmHg. Diabetes, as we all know, is a group of common endocrine disease that is characterized by sustained high blood sugar levels. It is either due to the pancreas not producing enough insulin or the cells of the body becoming unresponsive to the hormone's effect. The classical symptoms include triad of polyuria, polydipsia, and polyphagia. If left untreated, the disease can lead to various health complications, including disorders of cardiovascular system, eye, kidney, and nerves. Diabetes accounts for approximately 4.2 million deaths every year, with an estimated 1.5 million caused by either untreated or poorly treated diabetes. The major type of diabetes are type 1 and type 2 diabetes. WHO has reported that diabetes was among the top 10 causes of death in 2021. So there was a significant increase in the percentage of 95% since 2000. It is estimated that by 2045, approximately 783 million adults, or we can say 1 in 8, will be living with diabetes, representing a 46% increase from the current figures. The prevalence of the disease continues to increase, most dramatically in low and middle income nations. Rates are similar in men and women, and diabetes is the seventh leading cause of death globally. The expenditure on diabetes related healthcare is estimated to be 760 billion US dollars in a year globally. Now, here we will be discussing about diabetic nephropathy, which is one of the devastating complications of diabetes. It affects almost 40% of the patients. It is characterized by progressive kidney damage that leads to chronic kidney disease and end stage renal disease that requires dialysis or kidney transplantation for the patient's survival. The conventional treatment for diabetic nephropathy focuses on slowing disease progression through glycemic control, blood pressure management, and blockade of the renin angiotensin aldosterone system. However, these interventions often fail to halt or reverse the disease progression, and the need for innovative approaches to manage diabetic nephropathy remains pressing. In recent years, intensive lifestyle interventions have emerged as a promising adjunctive therapy for diabetic nephropathy. So before we talk about the interventions, we'll briefly discuss about the pathophysiological mechanism of diabetic nephropathy. So there is increased pressure, that is glomerular hypertension, and there is hyperfiltration, which causes the damage to the glomeruli. There is accumulation of advanced glycosylation end products, which stimulates oxidative stress and inflammation. The increased blood pressure activates the renin-angiotensin-aldosterone system and promotes fibrosis. There is podocyte injury, there is loss of podocytes, which leads to proteinuria and progressive kidney damage. Eventually, there is scarring of the tubules and interstitium, which impairs the kidney function. There are five stages of diabetic nephropathy. The first stage is of hyperfiltration, where there is increased GFR and the kidney function remains normal. Then stage 2 is incipient nephropathy, where there is microalbuminuria less than 300 milligrams per 24 hours and the kidney damage is mild. Then there is overt nephropathy, which is stage 3, where there is moderate kidney damage with macroalbuminuria more than 300 milligrams per 24 hours. Then stage 4 is advanced nephropathy, where there is severe kidney damage and reduced GFR. Then end stage renal disease, where there is complete kidney failure, which requires dialysis or kidney transplantation. So the risk factors: glomerular filtration, genetics, age and race, hyperglycemia, dyslipidemia, hypertension, hyperproteinuria, dietary factors, and smoking. So, the lifestyle interventions encompass a range of evidence based lifestyle modifications, which includes plant based diets, regular exercise, stress management, and sleep optimization. These interventions have been shown to improve glycemic control, cardiovascular risk factors, and renal function in patients with diabetes and CKD. This particular case report presents a remarkable example of diabetic nephropathy reversal in a patient with type 2 diabetes achieved through an intensive lifestyle intervention program. The patient's journey demonstrates the potential for the intensive lifestyle interventions to halt and reverse diabetic nephropathy, highlighting the need for further research and integration of these approaches into clinical practice. This comprehensive intervention aims to address the complex needs of individuals with type 2 diabetes, promoting sustainable lifestyle changes and improving overall health outcomes. So, here are the conventional methods that are used and some of their potential side effects. Like the AC inhibitors lead to cough, hyperkalemia, and renal impairment. ARBs cause hyperkalemia, renal impairment, increased risk of cardiovascular events. The direct renin inhibitors lead to hyperkalemia, renal impairment, and increase the risk of cardiovascular events. Glucocorticoids cause hyperglycemia, weight gain, osteoporosis, increase the risk of infections. Immunosuppressants increase risk of infection, malignancies, and organ damage. Pentoxifylline cause GI disturbances, dizziness, and headache. The end-stage renal disease, its treatment, dialysis, which can be hemo or peritoneal dialysis, both cause increase in the risk of infection, vascular access complications, fluid overload, or peritonitis. Kidney transplantation result in rejection of the graft, immunosuppressant side effects, and surgical complications. The SGLT2 inhibitors lead to genital mycotic infections, hypertension, and increase the risk of lower limb amputation. Phosphate binders lead to GI disturbances, hypocalcemia, and vascular calcification. Erythropoiesis stimulating agents lead to hypertension, thrombosis, and increase the risk of cardiovascular events. But it is very important to note that these methods may be necessary and effective for some patients. But it's crucial to carefully weigh the risk and benefit and consider individual patient needs and circumstances. The intensive lifestyle interventions can often be used in conjunction with these methods to enhance their effectiveness and minimize their ill effects. So, the points that are in favor of intensive lifestyle intervention. Now, they are cost effective compared to the pharmaceutical intervention, so that reduces the healthcare expenditure. They address multiple aspects of health, including glycemic control, blood pressure management, weight management, cardiovascular risk factor reduction. They can be tailored to individual patient needs and preferences, so that promotes adherence and sustainability. They may reduce or eliminate the need of various medications and minimize their side effects and interactions. So, hence, they overall increase the well being of the patient, their energy levels, mental health, so that ensures a better quality of life. The intensive lifestyle interventions have also shown to improve the renal function that reduces the risk of disease progression. They also decrease systemic inflammation, which is a key contributor to diabetic nephropathy progression. ILIs educate and empower patients to take control of their own health, so that promotes self management and autonomy. It can be maintained for a long term, so that leads to sustained benefits and reduces the disease progression. It can be used in conjunction with the other conventional treatments, and that would enhance their effectiveness. So, these points highlight the comprehensive benefits of the ILIs for diabetic nephropathy management, making a strong case for, for their integration into clinical practice. So, our main goals were to reduce the weight of the patient 5 to 10% of his initial body weight, improve the glycemic control, increase his physical fitness, reduce his blood pressure, and enhance his overall well being and quality of life. The patient underwent an intensive lifestyle intervention program for a period of 6 months. So, the components were dietary modification, physical activity, stress management, sleep and relaxation, and of course, there was monitoring and our support. In terms of the dietary modification, the caloric restriction was done 1500 kilocal per day. The macronutrient balance was 15% of protein, 25% of fat, 60% of carbohydrate. The meal frequency was maintained to 4 to 6 main meals and 2 to 3 snacks. The patient took low sodium diet, less than 2300 milligrams per day, which helped in reducing blood pressure and albuminuria. So the low protein diet that was incorporated reduces the kidney workload. The low fat diet improves the lipid profile. High fiber diet promotes the regularization of blood sugar and blood pressure. Also, the patient maintained an adequate fluid intake of 8 to 10 cups per day, and patient took high potassium-rich foods, which helped in maintaining his blood pressure. The patient avoided processed meat, sugary drinks, refined carbohydrates, and high sodium foods. Then the patient was asked for cessation of smoking. Nicotine gums were given to the patient. Apart from that, counseling was done. We also have medication options like bupropion and warfarin. Physical activity. The patient did high intensity interval training, 30 minutes 3 times a week. He did resistance training as well, 2 times a week, targeting his major muscle groups. He did aerobic exercises 150 minutes per week, moderate intensity, which improved his cardiovascular health. And he did daily walking of 10,000 steps. Then, of course, stress management. Mindfulness of meditation of 20 minutes 3 times a week was done by the patient, which helped in reducing stress and anxiety. He did yoga twice a week, which focused on relaxation and flexibility. He also did deep breathing exercises daily for 10 to 15 minutes, which helped in improving his blood pressure. Then there is sleep and relaxation. The sleep duration that he had was 7 to 8 hours per night. He had a consistent sleeping schedule, and relaxation technique was also incorporated by him, which helped in progressive muscle relaxation and visualization. We also provided our support, and there was regular monitoring. There were weekly meetings with a registered dietitian and exercise physiologist. There was continuous glucose monitoring and blood pressure monitoring, and there was also support group participation. So it was important for us to see how our intervention is progressing. So we had weekly food diaries and physical activity logs. We had bi-weekly weight and body composition assessments. We had regular glucose, blood pressure, and lipid profile measurements. And we also had a standardized questionnaire about the quality of life, depression, and anxiety. So, the outcome of our intensive lifestyle intervention of 6 months. So, there was significant improvement in glycemic control, which was initially 10.5 and got reduced to 6.5%. So, a 3.8% reduction. The fasting plasma glucose decreased from 180 milligram per deciliter to 120 milligram per deciliter. There was improvement in renal function as well. The GFR increased from 45 to 60, that is 33% improvement. Proteinuria decreased from 2.5 to zero point 0.5, so there was a 75% reduction. The blood pressure, systolic, decreased from 150 to 120, so there was 20% reduction, and there was also 11% reduction in the diastolic blood pressure, which decreased from 90 to 80 mmHg. There was improvement in lipid profile as well. The total cholesterol decreased from 200 to 150, LDL cholesterol decreased from 120 to 80, and HDL cholesterol increased from 30 to 40, that is 33% increase. The weight decreased from 90 kgs to 80 kgs. The body mass index decreased from 32 to 28, so there was a 12% reduction. The waist circumference decreased from 110 centimeters to 95 centimeters. So, through a standardized questionnaire, we also got to know that the patient had an improved overall well being and quality of life. So, these outcomes clearly demonstrate the effectiveness of intensive lifestyle intervention in improving the glycemic control, renal function test, lipid profile, blood pressure, weight, and quality of the patient with diabetes mellitus having diabetic nephropathy. So, the implications of the intervention. Healthcare providers should prioritize lifestyle modification as a first line treatment for type 2 diabetes. Patients with type 2 diabetes should always be encouraged to adopt comprehensive lifestyle changes, including dietary modification, physical activity, and stress management. Further research needs to be done. It needs to be done to explore the long term effects of intensive lifestyle intervention on clinical outcome and quality of life of patients with type 2 diabetes. Now, in this particular patient, there were several factors that contributed to our success. First was the multidisciplinary approach because we had combination of dietary changes, physical activity, stress, and medication that helps in optimizing the complex pathophysiology of diabetic nephropathy. Patient also had a long-term commitment to caloric restriction, which is very difficult. He did high-intensity interval training, and there was stress reduction as well, which enhanced in insulin sensitivity, improved the cardiovascular health, and overall reduced the inflammation. Also, initiating the lifestyle intervention changes as at an early stage of nephropathy may have prevented further renal damage and allowed for partial recovery of kidney function in this patient. Tailoring this intervention to patient specific needs and health status also helps us in optimizing the outcome. Now, this particular case report also supports the American Diabetes Association's recommendation for lifestyle modification as a primary intervention for diabetic nephropathy. It also underscores the importance of early detection and treatment, multidisciplinary care, patient education, and empowerment to adopt sustainable lifestyle changes. While this is just a single case report, it suggests that intervention lifestyle may be a valuable adjunct to pharmacological treatment in managing diabetic nephropathy and warrants further investigation in larger studies. There were a couple of changes like Initially, there was lack of motivation, there was limited access to the resources, poor health, literacy, and cultural and socioeconomic factors. But we set up realistic goals. We just gave the patient our support. There was support from family and friends. We celebrated his milestones. And of course, there was professional help, which was timely given. The single study also has some limitations, like this is directed towards a single patient, so it may not be generalized to all patients with type 2 diabetes. So we need to do further studies with larger sample sizes and longer follow-up periods to confirm our findings. Overall, however, this case study highlights the potential for intensive lifestyle intervention to improve clinical outcome and quality of life in patients with type 2 diabetes, which supports its use as a primary treatment approach. So, this is what the patient said. The lifestyle change was challenging at first, but the results have been incredible. I feel more energetic and my overall health has improved significantly. This is what the patient's perspective was. So, further research is needed to be done on this to explore the potential benefit and feasibility of implementing intensive lifestyle intervention in clinical practice. So, a take home message from me: take control of your health. Comprehensive lifestyle interventions can reverse diabetic kidney disease and improve kidney function, empowering individuals with type 2 diabetes to manage their conditions effectively. Thank you so much.